The world, Canada included, has become complacent about HIV/AIDS. That's according to two reports from the United Nations and researchers in Cape Town. And while these reports do note that there has been success in reducing AIDS deaths, the problem facing us now is a rise in new cases of HIV, and they warn time is running out. In 2016, Canada saw an 11% increase in new HIV cases from the previous year. If this trend isn't corrected, according to these two reports, researchers are warning the world could lose the ability to manage the disease altogether. Joining us this morning is Gary Lacasse. He's the Executive Director of the Canadian AIDS Society. Good to have you with us this morning.
Hello, how are you?
I'm well this morning. Let's talk about these reports. They take a look from a global perspective. Have we become complacent towards HIV/AIDS here in Canada specifically?
Specifically in Canada, we've been saying it for 2 years now. Yes, we have become complacent. We were hoping with the new government that we would see more strategic alignment with investment into the HIV strategy in Canada, but that has fallen on deaf ears with this new government.
The big question here then is why? Let's dig into that. In 2004, a new federal initiative to fund HIV/AIDS research was announced. Funding levels there increasing every year. But since 2008, annual funding for HIV/AIDS research has stayed the same at $84.4 million. So how much of the problem is with these new cases coming up is due to lack of funding?
It's a huge issue because when we're looking at the new strategy here in Canada, which is preventing HIV for people who are not infected, but that's where the 99% of the money is going these days. But the support or secondary prevention to people who have HIV to ensure that all their needs are met and that they're on their meds and they don't transmit HIV, that has been completely defunded by this government. And that's what we're saying complacency about. Because if we don't have a multi-pronged approach to fighting HIV and AIDS here in Canada, we're going to see the rates rise. And just with yesterday's reports out of Nova Scotia, they already have the annual rate of HIV infections down for the year already. So this trend is trending elsewhere in Canada too. So we're expecting higher numbers this year.
Aside from funding, which is an important part of this puzzle, medications like PrEP combined with lower death rates, could that also be contributing to a false sense of security?
I think that PrEP is an added tool in our toolkit for prevention. So that, for me, it's not adding to the deaths. I don't think so. I think it's more priority populations that we are not meeting their basic needs. And I think that's across Canada and the world too. And there is a lack of funding that's demonstrated throughout the world and specifically here in our own backyard in Canada. So I think that has to be addressed. And PrEP is not necessarily the cause.
You mentioned community-based organizations, and back in January, the government did announce they would invest $132 million into some of those community-based organizations in the next 5 years. How important are those organizations, especially in remote and marginalized communities?
Okay, I would redo the math on that $130 million because it's old money and new money, a bit of new money. So there's only a slight increase in funding, but for strategic placement of money. And I find that we have to, when we're looking at like Saskatchewan, Saskatchewan opened their first AIDS hospice 2 years ago. That's unfathomable in Canada to see that we are opening up an AIDS hospice. People are dying of AIDS across Canada still today. So when we're looking at the Liberals have been really coming out with these funding announcements that are untrue and based in old money being recycled, which is not giving, the discourse is being centered around all these announcements when we have to do the work on the ground, and community-based organizations are doing that and have been doing that successfully for years.
Gary, there are some targets that are sent out. Canada is saying they are supporting this 90-90-90 target that was set out by the UN and the World Health Organization. Basically, what it means is that by 2020, 90% of those living with HIV will know their status, 90% will receive treatment, and 90% will have undetectable levels of the disease in their viral loads. Is Canada on track to hit this target?
No, we're not. From what I've heard from very high-level officials is that we're hoping to hit 70, 70, 70. So when we backtrack to 2.5 years ago, the Minister of Health, Minister Philpott, had guaranteed that we'd be at 90-90-90 and that her strategies for funding would get us there. Well, we told her 2.5 years ago, that's unfounded to think that we're going to get there. And we're having these numbers coming out at us and that are drastically under the objectives. Some countries in Africa are outperforming Canada, which is unacceptable because we should be leading the way.
Gary Lacasse joining us this morning. Thanks so much.